So I'm Dr. George Lockwood, and I'm on the executive board of the International Society of Schema Therapy. And I'm talking today with Travis Atkinson, who's an expert in marriage and couples therapy, and his extensive training in schema therapy with Jeffrey Young, and an emotional focused couples therapy with Susan Johnson, and in the Gottman approach to couples therapy with Dr. John Gottman. So, Travis, we've talked some about your work in couples therapy, and I know you've been specializing in this for a lot of years. It'd be interesting to hear your overview and also to hear a little bit about your workshop that you'll be doing at the World Conference in Schema Therapy. So we have
Mhm.
the fifth ISST World Congress to be held in New York City, uh, May 17th through 19th, and on the 17th you'll be giving your workshop. So if you can talk a little bit about that and the things you'll be covering, and some of your current perspectives on the couples therapy from the more integrative perspective.
Sure, absolutely, absolutely. Well, I'm glad to be able to share a little bit about what's going to be happening in the workshop. Excited that the world's going to be coming to New York, that we get to host everyone, and probably the most beautiful time of the year to be in New York, May and September. So very
Uh-huh.
excited to see everyone in ISST and welcome all the new members as well.
Uh-huh.
And for those who will be attending my workshop, talk about couples and the exciting work that we can do using schema therapy on couples. That, in a lot of ways, I think one of the most exciting things about schema therapy is that we do emphasize how it's integrated. We want to be able to include a lot of different models and what they can bring. And that's what I'll be talking about in my workshop, is how we can focus on cognitive, emotional, and behavioral aspects.
Mm-hmm. Okay. So tell me, one of the themes of the conference will be limited reparenting, and can you say some about that? And also in relation to the other approaches, because I think that's something that's unique about schema therapy is limited reparenting, and how does that juxtapose with what you've uh, know as far as emotion focused therapy and then Gottman's work as well?
Sure. I mean, with limited reparenting, and since the conference is also focused on attachment and attachment styles, we can look at the limited reparenting approaches. How do we get each partner in the relationship to help each other get to a place where they have a secure attachment?
Mm-hmm.
So in some ways where they can really build on their healthy adult, and they can have more of their vulnerable child or their happier, contented child available to each other, which usually are the ways that a couple is going to be connecting the most.
Mm-hmm.
With schema therapy, like I was saying a moment ago, because we have cognitive experiential techniques and behavioral techniques, I see personally that we can expand on emotionally focused therapy and Gottman's work. I have worked quite a bit with Sue, and was in the Gottman program for about 8 years. I think Gottman's work is really helpful in knowing what we want to make sure we're not doing in terms of some of the maladaptive modes, the angry child, or an impulsive, undisciplined child. When we're working with a couple, what we can target to help them so that they're not getting stuck in a negative mode cycle.
Mm-hmm.
In terms of emotionally focused work, again, just another example of going into real depth of what we can do to do that limited reparenting, how to be with each partner, especially when they're getting escalated. I think that's one of the most challenging things for a lot of couples therapists, is what do you do when you're in the room and you have a real severe escalation occurring? How can you go in a way that isn't punitive or isn't critical, that you can really maintain your empathy towards both of the partners, especially when one of the partners may be triggering our own schemas at the time, which can happen.
Mm-hmm.
Uh, and slowing down that process, slowing down that cycle, and being able to step in and set limits when we need to, in a way, again, that's not shaming, but understanding. I think we have a really unique approach in terms of being able to put that all together.
Mm-hmm.
We have that framework. Schema therapy to me is the framework that we can use to broaden a lot of other approaches. And I'm sure a lot of people that will be going to the workshop that do couples therapy are already bringing in a lot of different components that they've learned from other types of therapies into schema therapy.
Mm-hmm. Yeah, it's good. So Gottman is particularly good in terms of looking behaviorally, concretely at what's going on and what's problematic, what thwarts communication, effective communication. You're saying, and with Susan's work, it's more capturing some of the emotional intensity of it and drawing on strategies that she's developed for that aspect.
Yeah, you could say that. I mean, Gottman's research in terms of what are the main factors of what can break up a relationship is really helpful because you can see, especially during the assessment process, if some of the four horsemen, for instance, are pretty apparent in their dynamic just by having the couple have a conflict in front of you, for instance, if they go into criticism or defensiveness or contempt or stonewalling, you know that you need to step in pretty quickly to help them to shift that dynamic. And
Mm-hmm.
that's where Sue Johnson's work with how to create a safe emotional bond can come in and be so helpful that we want to help the couple to feel like they can go and access their vulnerable child. So initially in the schema therapy approach, we're trying to help them, first of all, to be aware of their vulnerable child, to access that, to bring it out, to give it a language. And there are a lot of emotionally focused techniques that we can use to do that. But we're also giving it a cognitive frame. We can see that, hey, there's a reason this is happening. And then the schema approach is really getting at areas of sensitivity. So a lot of different therapies use different words to describe sensitivities or raw spots, Sue's words. But we actually know what those specific sensitivities or raw spots are. And I think that's what's also very exciting about the schema therapy approach is we can say, well, this isn't just an anxiety. This is a very specific anxiety about a person going into shame. For instance, a lot of men thinking that if their wives are not happy with them, it's because they're disappointing them, and then they get anxious. A lot of times they might get angry, defensive, and then start withdrawing, backing away, going into a detached protector mode, which, of course, when that happens, is going to make the wife or the other partner quite anxious because they oftentimes will feel a lot of abandonment, I mean, emotional abandonment occurring,
Mm-hmm.
sending them off into a panic state, especially if they have a sensitivity to the abandonment schema.
Mm-hmm.
And then you've got that pattern, that mode cycle happening where the more one person is withdrawing, the more the other person is getting angry and attacking.
So
It's
you
like
see,
child mode.
yeah. So you're saying with with schema therapy, the modes, having the language for the modes and being able to talk more specifically about what states the couples are getting into or triggering back and forth, and having more specific language for the kinds of issues around anxiety or sadness is that schemas would allow us. It helps to track more closely and make more sense of what's happening in the dynamics of the couple.
Exactly. I think
Yeah.
that with Jeff, Jeff Young originally creating schema therapy, he's brilliant in terms of strategy. Seeing, identifying what is happening, what's maybe dysfunctional about an individual or a couple, and then actually having strategies. What can we do for this specific thing for a couple where one partner has a lot of emotional deprivation and another partner has defectiveness? So no one is really going to understand me. No one's really going to care about me. No one's going to get me, or common beliefs that a person has with emotional deprivation, of course. And then let's use another example where the person has defectiveness. If the other partner has this feeling like they're not really good enough or there's something wrong with them, you put those two schemas together in a relationship, which oftentimes will be happening when they're coming to see us, the couple being in distress. Now, the great thing, again, about schema therapy is with that strategy, knowing what we're trying to work on improving, we can set up enactments, which is kind of a common word in emotionally focused therapy. We can set up enactments where each partner is specifically trying to help counter or give an antidote to the other partner's schema. So the therapist can be directing and facilitating dialogues, imagery work, different ways of helping the partner with emotional deprivation, and the example that I'm using, actually feel cared for, feel understood by the partner, which is going to matter more than anyone. I think it matters a lot more than the therapist validating or understanding or caring for the patient. To have their partner in the room, the person who matters most to them, be the one who is doing the validating, the caring, the nurturing, the protecting, everything that they really have always needed.